Hi, my name is Amanda, and I'm a genetic counselor. Today we are going to talk about the causes of hereditary breast and ovarian cancer and how it can be passed down in families. You will learn how these cancers can be detected early and how to reduce your cancer risk if your family has hereditary cancer. Cancer is a common disease. This year, more than 1 million Americans will be diagnosed. Most cancers occur in people over the age of 55, and most are considered sporadic cancer, meaning they happen by chance. Only 5 to 10% of cancers are hereditary. Hereditary cancers have some important features in common. These cancers usually occur at an earlier age. In families, more than one family member may have the same cancer, and the cancer may occur in several generations. For example, a grandmother, mother, and daughter may have the same cancer. Hereditary cancer is more likely to develop in more than one area in the body. And finally, rare cancers may occur in these families, such as male breast cancer. To determine your risk for hereditary cancer, you must know your family history. A family with hereditary cancer has a pattern of cancer often going back several generations, so researching and writing down your family history is a good way to start. Sometimes people are born with gene changes that cause cancer. This is called hereditary cancer. Genes are like a set of instructions that tell your body what to do. Some genes determine your hair and eye color, how tall you are, and your blood type. Other genes tell your body how to grow and develop. Genes can also help protect the body from diseases like cancer. For example, the BRCA1 and BRCA2 genes both help prevent breast and ovarian cancer from happening. Your body must read your genes like a set of instructions. If there are mistakes or incomplete instructions in the genes, then your body will not know what to do. These mistakes are called mutations. Most hereditary breast and ovarian cancers are caused by a mutation in either the BRCA1 or BRCA2 genes. If one of these genes is not working, then breast and ovarian cancers are more likely to develop and more likely to occur at a younger age than usual. Gene mutations in the BRCA1 and BRCA2 genes not only increase your chances of getting cancer, but they can be passed down to your children. Each person has 2 copies of all genes. One copy is inherited from your mother, and one copy is inherited from your father. Hereditary breast and ovarian cancer is caused by inheriting one gene mutation in the BRCA1 or BRCA2 gene from either your mother or your father. If someone has a BRCA mutation, there is a 50% chance the mutation will be passed on to each of their children. Think about when you flip a coin. There is a 50% chance it will land on heads, and a 50% chance it will land on tails. The same is true for people with a mutation. They could either pass on the mutation or not pass on the mutation. If a BRCA mutation is passed on to a child, the child has a high risk to develop cancer as an adult. If a child does not inherit the mutation, he or she has a normal risk of developing cancer, same as the general population. If a woman has a BRCA mutation, she has between a 50 and 85% chance to get breast cancer. She would have a 40 to 60% chance of getting a second cancer in her other breast. And she would have a 27 to 44% chance to get ovarian cancer. Men with a BRCA mutation have approximately a 6% chance to develop breast cancer and a 20% chance to develop prostate cancer. There is also a small increase in risk of developing melanoma, a type of skin cancer, and cancer of the pancreas in both men and women. Women who have a mutation should visit the doctor more often and start cancer screening at a younger age. Women should begin mammograms and breast MRIs at the age of 25. These are 2 different ways for doctors to screen for breast cancer. Some women with a mutation are concerned about their high risk of cancer, and they may decide to have surgery to remove both breasts. This is the best way for a woman to reduce her risk of getting breast cancer. Talk to your doctor to see if this is the best option for you. Women who have a BRCA mutation should also visit their doctor to screen for ovarian cancer. This is done with a blood test and a vaginal ultrasound every 6 months. For women who are older than 35 and do not wish to have any more children, it is recommended that they have surgery to remove their ovaries. Genetic testing is done by taking 1 tube of blood, usually from your arm. The genetic testing laboratory will read through your BRCA genes to look for mistakes or mutations. If a mistake is found in your blood, this is considered a positive genetic test result, and you will need to visit with your doctor more often to look for breast and ovarian cancer. If no mistakes or mutations are found in your blood, you will have a negative genetic test result. Even if your result is negative, you may still need to meet with your doctor more often if you have several family members with breast and ovarian cancer. A third possible test result is called a variant, or an uncertain result. This is when the laboratory finds a very small change in your BRCA1 or BRCA2 gene. They do not have enough information to decide if the small change causes a high risk of cancer or not. If you receive this result, you should talk to your doctor about how often you need to be seen. Persons with a variant will have a different schedule of checkups with their doctor. After your blood is drawn, it will take about 3 weeks until the results are ready. You will meet with a genetic counselor or your doctor in the clinic to talk about your results. Your doctor will talk to you about what your results mean for you and your family. Your doctor will also talk to you if other family members will need genetic testing or if they need to be screened for cancer more often. If you decide to have your blood drawn for the genetic test, there are some benefits, risks, and limitations. The test results can help you and your doctor make choices about the health of your breast and ovaries in the future. The test results can also give your family information about their chances to get breast or ovarian cancer. They may need to have genetic testing too. When you have your blood drawn for the genetic test, there is a risk for developing a bruise, feeling dizzy, or developing an infection. After your test is complete for the BRCA1 and BRCA2 genes, your doctor might tell you to test other genes. It is important to talk to your doctor about testing other genes, and it is important to tell your doctor if anyone else in your family gets cancer in the future. Some people are worried their family members will not be able to get health insurance if they have a positive genetic test result. There are laws that help protect people who have a positive result. Even though BRCA mutations greatly increase your risk for cancer, it is important to remember that only 5 to 10% of cancers are considered hereditary. After hearing this information, you may be concerned about your family history of cancer. If you are, we invite you to stay and learn more.